What is the difference between I like you and I love you? When you like a flower, you just pluck it. But when you love a flower, you water it daily. One who understands this, understand life. So do not pluck the flower, just love it and give the water daily. Now the clinical feature of the dengue fever. Dengue fever basically it is of two types, primary infection and secondary infection. The first, the primary infection of the dengue fever, patient in non-endemic areas have primary infection. Primary infection results in a febrile, self-limiting viral disease. Severe flu-like illness affects infants, young children and adults, and the features varies with the age of the patient. Infants and young children have a non-specific febrile illness with a rash, and here one can see the patient complain of arthralgia, myalgia, retroorbital pain, headache, epistaxis sometimes, chills, high-grade fever, nausea and vomiting, and the rash appears and people are very much worried about the platelets, and the platelets start decreasing to less than 150,000. So here again the headache and the fever, and one can see the different muscle pains and the rashes, which are the sign and symptom of the dengue. And older children and adults may have mild febrile syndrome or classical disease with abrupt onset and high fever, severe headache, pain behind the eyes, muscle and joint pains, and maculopapular rash, as I have already shown you in the previous slides. These last for 3 to 5 days, and recovery may be associated with the fatigue and depression. Here one can see again the dengue sign and symptom: high fever, nausea, vomiting, body rash, joint pain, headache, and the pain behind eyes, the muscle ache, and all these are just giving you some clue that the patient may be having the dengue fever. Now, the dengue fever secondary infection. It results in the severe complications such as dengue shock syndrome or the dengue hemorrhagic fever. Dengue hemorrhagic fever leads to dengue shock syndrome, which is very fatal. Over 90% of the cases occur in the patients previously infected with virus, and so that is called secondary infection. Symptoms are similar to those seen in the primary infection. After 3 to 7 days, patient display rash seen in the patient of the endemic areas. Characteristic antibody response to the disease enables serological diagnosis, and the differentiation between primary and secondary dengue can be checked by this test. Antibodies, IgM tells the recent, and IgG, if present, tells the secondary infection the patient was previously infected. Now, the symptoms of the secondary dengue fever. The first is the febrile phase. There's sudden onset fever, headache, mouth and nose bleeding, muscle and joint pain, vomiting, rash, diarrhea. Now, this patient then go to the critical phase in which there is hypotension, pleural effusion, ascites, gastrointestinal bleeding, and that is the dangerous, even that can go to the dengue shock syndrome also. Or there could be the chance of recovery phase. There is altered level of the consciousness and seizure, itching, and slow heart rate. So that is the recovery phase of that. The first is febrile phase, then critical phase, and then is the recovery phase of secondary infection. Now, dengue hemorrhagic fever, it is a complication present with high fever, hemorrhagic phenomena, hepatomegaly, and circulatory failure. The illness begins with a sudden rise in the temperature facial flush, fever continues for 2 to 7 days, high 40 to 41 degrees centigrade, febrile convulsions, and hemorrhagic phenomena occurs. In severe cases, temperature drops followed by the sign of circulatory failure, shock, and die within 12 to 24 hours. That is hemorrhagic shock syndrome. Recovery following appropriate volume replacement therapy is there, but one have to be very vigilant regarding this. Now, grades of the dengue hemorrhagic fever. These are grade 1 fever and non-specific constitutional symptom with the positive Tourniquet test being the only hemorrhagic manifestation. In grade 2, grade 1 manifestation plus spontaneous bleeding occurs. In grade 3, circulatory failure manifested as rapid weak pulse with cold skin restlessness and narrow pulse pressure or hypertension. That is the typical hemorrhagic shock syndrome. And grade 4, profound shock with the non-detectable pulse or the blood pressure, and these are just going to be the serious, and the patient can lose his or her life also. Now, the hemorrhagic symptoms of this dengue hemorrhagic fever are bleeding, particularly in the skin, petechiae, gums, and nose, increased vascular permeability, so leakage of the plasma into the extravascular spaces, leading to the hypertension. This leads to the hypovolemia, hemorrhagic symptom, reduced blood pressure, coagulopathy, circulatory shock, vomiting, and abdominal pain, lymphadenopathy and hepatomegaly, presence of the blood in the stool, that is melena, vomitis, hematemesis, urine, hematuria, two-stage fever, fever for the 3 days, become normal for 1 day and rise again. So here one can see the dengue rash on the back, on the legs, on the eye, the bleeding subconjunctival, and ecchymosis on the arms or the legs. These are all dengue rash which is seen in the dengue hemorrhagic fever. Again, one can see the rash on the leg, on the abdomen, on the both legs, on the arm, and one can appreciate the rash on the arm just to have the diagnosis of dengue. Now, primary dengue infection, the virus is there, and after 5-6 days it just becomes okay, and it is just being killed by the body. And NS1 protein, which is seen, that is apparent in the blood up to 7 to 9 days, and then one can see the appearance of the IgM antibody, that is 5th day, and it lasts up to 90 days, and IgG antibodies that start appearing after about 2 weeks, and that remains in the blood for a longer time, that can be detected as a cough or dengue fever. But here in secondary dengue infection, the virus also disappear after 7 days, and IgM appear at 5th day and remains there for a few days, and NS1 is also just going to be appear up to 7 to 9 days, and then IgG that appear and remain in the blood after the onset of the symptom many days, that can be detected by the antigen antibody test. So just imagine a house so beautifully, so skillfully made someone at some hilltop which was inside the water, and to make this dream house, it is really something very special and something very laborious done by someone to make it an exemplary house to live. Now, diagnosis of the dengue fever Clinical diagnosis by the typical sign and symptom already I have told you. Many patients may notice a change in the taste and sensation. It is not diagnosed correctly due to the generalized and non-specific clinical manifestation. The acute phase of 1 week is followed by a 1 to 2 week period of convalescence in which the patient recovers with weakness, malaise, and anorexia remains. Diagnosis is by the viral antigen NS1 detection or specific antibodies IgM, IgG by serology or virus isolation in the cell culture or by the PCR one can detect the nucleic acid of the dengue virus that is helping the diagnosis. So the dengue test, as one can see, the dengue test is done by NS1 detection. NS1 protein is the part of the protein of the dengue virus which is detected by this strip, and the high fever is also giving the clue that the patient is having the dengue fever. Virus isolation and nucleic acid detection are more accurate than antigen detection, but there are four no's which make dengue a dreaded disease and one have to be careful. There is no specific pathognomic clinical feature, no user-friendly quick lab test, no specific antiviral therapy available, no specific preventive tool available. So the serological test shows antibody to the virus. It can distinguish between primary from secondary infection because in primary one can detect IgM and secondary one can have the IgG. So the direct method of diagnosis are virus isolation by the culture, genome detection by the PCR, and the antigen detection NS1, which is very cheap and easy and detected from day 1 to day 9. Then indirect method is the production of the antibodies against these viruses. These are the IgM antibodies which appear earlier and IgG antibodies which appear later. So the specificity of these tests, one can see the virus isolation, the genome, these are more accurate. And then we come toward this tapering, that is less IgM and IgG give clue about the diagnosis. Now, serological to detect IgM, IgG antibodies. IgM antibodies, I have told you, already appear in the blood at the end of the 8 days in the earlier part of the disease and persist for 1 to 3 months. It indicates acute infection always. Immunochromatography, serological sensitivity, serum sensitivity is 96.3%, whole blood sensitivity is 89.9%. So better to do the test on the serum for more accurate test. Serological specificity, serum 95% and the whole blood indicates that one should not do it rapidly on the whole blood, but just get out the serum of the patient and do the test for the more sensitive and accurate results. Now, the rapid test available is dengue NS1 antigen strip. For qualitative means just detection of the dengue virus NS1 antigen in the human serum or the plasma. It is easy to perform rapid and specific test to confirm infection. In acute phase of infection, NS1 antigen is a non-structural protein and the marker of the acute phase of the dengue infection. Besides E and M protein of the dengue, this is also a non-structural protein present in every virus and can be detected. Other serological antibodies-based methods are of limited value. NS1 antigen is found in infected patients sample from day 1 to day 9 after the fever, so easy to do. And here one can see the strip which have not been used, the empty strip, and this is NS1 protein which is being detected, and here after putting the serum in that one can have these kind of appearances. If just one line, it means negative control, mean the strip is okay. And if the two lines are here, it means NS1 is positive. It is the positive dengue test. And if just one is positive but the control is absent, it means the test is invalid. Now, continuing that dengue antibody test strip, here one can see if one line besides control line is there, that is positive, and if just control line and no other line mean negative, and if no control line and just this test line, it means invalid. And here again one can see the negative, and here IgM positive. If two lines are present, it means IgM, IgG is positive. And if just one line and the control is positive, this line indicates the IgG antibody. Now, there are combo units available which detect both NS1 and the dengue antibodies simultaneously in one strip. Here one can see the NS1 that is positive, and here that is the dengue IgG is positive. Similarly, here the T means the test is positive NS1, and here the two lines, that is IgM and IgG antibodies are positive. The other test for the diagnosis are heme agglutination inhibition test, HAI, isolation of the virus in the blood, that is culture of the virus done in the virology department, need 10 days for the result, quite expensive but confirmatory, and one cannot wait 10 days for the result because in those days anything can happen. Collect serum within 5 days after onset of the symptom for this isolation of virus in blood. These are just academic tests to remember but not practically applicable. Then polymerized chain reaction by amplification of the DNA. Deoxyribonucleic acid, very expensive and done rarely. And this facility is not available in every city and every lab. Acute waste sample for the virus diagnosis can be stored indefinitely on the dry ice, minus 60 degrees centigrade for indefinite period. Now, there are false positive results that is called cross-reactivity of this test that is seen in West Nile virus, Japanese encephalitis, Rose River virus, malaria, leptospirosis, Epstein-Barr virus, cytomegalovirus, hepatitis A, hepatitis B, hepatitis C, rheumatoid factor, and anti-nuclear antibody. These all give the false positive results, and these are not giving the dengue positive results. Now, differential diagnosis, illness may be clinically indistinguishable from influenza, measles, or rubella, but the tests are going to confirm your suspicion of dengue. Now, coming to the treatment, what are the aims of the treatment? Getting plenty of the bed rest, drinking lot of the fluid so that the fluid replacement is very important, taking medicine to reduce fever. No specific treatment for the primary dengue fever is there. For severe symptoms like shock and coma, give the symptomatic treatment. Early and the aggressive emergency treatment with fluid and electrolyte replacement is the drug treatment of choice for these. Now, treatment include use of plasma expander, control of secondary infection, oxygen therapy, blood transfusion in cases of severe bleeding, for pain and fever, acetaminophen preparations rather than aspirin and non-steroid anti-inflammatory drugs, because anticoagulant effects of the aspirin aggravate bleeding tendency, and the fresh blood transfusion even is much more beneficial because it gives the ready-made platelet to control the bleeding. And that is the end of the lecture. I hope that you may have liked this lecture. If you have liked this, please subscribe it. And if you have any question regarding, you can call me at my numbers